I'm Dr. Sandra Laura Cremers, and I'm going to talk today about what a cataract is and what astigmatism is. If your vision is not crystal clear, it can be due to many reasons. One of the first reasons is the tear film, which you've heard in some of my other videos. We want to make sure that your meibomian glands are working well, the tear surface is staying on the eye to give you quality of vision. If you have 20/20 vision but you're miserable, it's probably a tear film issue. Then, of course, there can be issues with astigmatism, which means that the surface of the cornea, instead of being shaped like the surface of a basketball, is shaped like the surface of a football, so it causes distortion in vision. And we can correct that in patients who either have LASIK, need refractive surgery with glasses and contact lenses. And if you're having cataract surgery or you're told you have a cataract, we can correct it at the time of cataract surgery, which for some patients will represent the first time they're going to be glasses free. It's not always the case, but many times we get people glasses free after cataract surgery. A cataract means that the clear lens inside the eyeball, which looks like a kind of like glass in a sense, you should be able to have light go through it, is becoming cloudy. And you can have something called a nuclear cataract. It blocks the vision completely. A cortical cataract, which tends to cause a lot of glare. There's something called pseudoexfoliation, which is associated with glaucoma, which kind of looks like this here, with some deposits on the surface. Or a posterior subcapsular cataract, where the opacity is on the back part of the lens. The lens is like a pillow in an enclosed pillowcase. And so in the posterior subcapsular cataract, the back part of the pillowcase or the back part of the lens, which is like the pillow in the pillowcase, becomes opacified. And these patients, the ones with the opacity on the back, tend to need a YAG laser after cataract surgery with a slightly greater percentage than normal. And so when we talk about a cataract, I mentioned we're going to open up the top part of the pillowcase, take out the pillow, and try to leave the back part of the pillowcase intact. And we do that now with femtosecond cataract surgery because it provides a safer situation for patients where the cutting of the front part of the pillowcase is precise with a laser. We can chop up the pillow or the cataract into many pieces and then suck it out. So the risk and complication rate is lower, the recovery time we're finding is lower, the stability of the implant is better. So we prefer femtosecond cataract surgery in all our patients, but it does cost extra. Insurance doesn't cover it. I want to show you what a mature cataract is. So if somebody has a mature cataract, we really highly recommend the femtosecond laser because it protects the endothelium, which is the inner surface of the cornea. So there's a inner surface here that's lined with very important cells that keep the cornea nice and clear. And so that's what a cataract and the lens looks like. When we have to decide on what implant is best for you, everyone's going to choose something different. It depends sometimes on your profession. It of course can depend a little bit on finances. But let me tell you some of the best options we have and what the standard of care is. So in terms of what we've had all along in implants, we've always had, since cataract surgery had implants, we've had something called a monofocal. It can be made out of acrylic or silicone, but it gives you one distance, and this is covered by insurance completely. It gives you distance, intermediate, or reading, but for everything else you'll need glasses. So about 100% of patients need glasses for something with a monofocal in general. Then came out something called the toric lens, which you can see these little kind of dots here, correct for astigmatism only, for the cornea astigmatism. So if you need glasses for the distance and you find that your astigmatism is the big culprit there, then we can put a toric lens that'll correct for one distance but correct the astigmatism. You would still need reading glasses, for instance, even if you have a toric. The multifocal is the other category, which has these little rings that give you distance for vision, vision for distance, intermediate, and reading, but it can sometimes cause a little bit of glare, and so people sometimes, if they do a lot of nighttime driving, sometimes prefer another option. And the final option that's come out recently is called a Symfony lens that sort of looks like the monofocal. There's no clear rings, but it provides a depth of focus. So the distance intermediate is very good with the Symfony. The halos and glare you can still get, but it's not as much as the multifocal. And the reading ability to be glasses free for reading is very good, but it's also not 100%, but very good. So those are the key categories. If it were my eye and my choice and money were not an issue, I would choose the femtosecond cataract surgery with a Symfony lens because I think that's going to give me the best quality of vision with the best outcomes. And then if you have glaucoma, I want to just show you what looks, this is the eye stent. It's an implant that we put in the drain of the eye. We perform that at the same time of cataract surgery. It tries to get us to not need glaucoma drops after the cataract surgery, and it's FDA approved, it's covered by many insurances, and it tries to help us decrease the need for drops and decrease your risk of glaucoma. So those are the key things with cataract surgery. I just want to show you some of the commonly used drops we have. We have Besivans, which is besifloxacin for antibiotic. There's a generic version that we feel is good, not as good as Besivans, but very good. And then of course there's Durezol, which is a steroid. So we always use an antibiotic and some steroid. And we use an anti-inflammatory that's non-steroidal. So this is Alevro, there's Prolenza, Ketorolac. So we usually use 3 classes of drops after the cataract surgery to help prevent infection. This prevents inflammation, and this other Alevro also prevents inflammation. So I hope that answered some people's questions. If you have any more, please let me know.